this question at the meeting, at our leadership meeting on Friday. And I always still like to quiz the team. And I was like, what did the empirical based interventions for feeding go? And they were just like, you see that?
Yeah.
They're like, what? Like, yeah, let's name them out. Who's got one? Come on, people. Who's got one? And so we know that ABA does have some effective strategies and empirical-based interventions for food expansion and food feeding. But then it comes right up against the line of medical, and you have to know where that line is to seek medical attention.
Yeah. And it kind of goes back to what we were discussing earlier about, is this behavior or is this pain, or is this something physical? Is this something different? Right. So I think the best approach to feeding really is a multidisciplinary approach. Behavior is certainly one of those components. And we do have some really good interventions that do work. But we're not going to solve a problem with swallowing. We're not going to solve a problem with absorption of nutrients, right? So that's where we really need these partners in other fields to really usher that child to the most healthy outcome possible.
Yeah. And it's not always through behavioral interventions.
Yeah.
But let's name the behavioral interventions since we're here.
So the ones, and I'm sure there are more actually.
Yeah.
But the ones that we are very familiar with, first of all, escape extinction, which we do not do.
Yeah, that is I've seen escape extinction done. That is so aversive to anyone shoving something in someone's mouth. And I think the board really took a lot of great feedback and made changes for scent-based care. So escape extinction with food expansion should probably never be done.
Correct.
Yeah.
And just a quick reminder for those of us who haven't heard us talk about this before, escape extinction is where essentially the child is put into a position where they are not able to leave and food is put into their mouth until they eat it. As you can imagine, this can be pretty traumatic and can lead to some further problems down the line, because if we're inflicting trauma, we're likely to cause further problems.
Yeah.
So
I never did that.
We don't do that.
Yeah.
We don't do that.
Now, if you have good sense and discernment, you could look at that intervention and be like, yeah, I'm not doing that. I always tell all the clinicians and the trainees, like, put yourself in their shoes. Would you like someone doing that to you?
Right.
If the answer is no, don't do it.
That's probably not the right
probably
thing to do.
not a good choice. Yeah.
Now, there are programs that are inpatient that do use escape extinction, and I'm not here to judge anyone for what they're doing. I think that for the most part, people are trying to do the best they can to help their patients. I just know that at Nurture and Nature, we don't do that within a home setting. And I think it's pretty dangerous actually to do within a home setting.
Yeah, I've never done it.
Yeah, I haven't either.
I don't think I ever would want.
Yeah. But it is an empirically based method. So there we've discussed escape extinction.
It is empirically based.
Yeah.
It's have research behind it. It does work, right?
Yes.
And it basically looks like spoon to lip until you open your mouth and eat it, right?
Yeah. And then there's also a method where they insert a brush into the mouth and open the jaw to put the food inside too. So there it's pretty intrusive.
Yeah.
Yeah.
It sounds pretty awful.
Yeah.
I think the feedback from the community on that intervention is probably pretty valid.
Yeah.
Because that reminds me of the book 1984. It's Orwellian.
Yeah.
I would not like that. Well, so I think the feedback's valid. Yeah.
It is valid. And I think that as a company, we have decided it is not right for us and it is not something that we would do, but things that we do use for diet expansion. Yeah. So the PRT method is a favorite of ours.
Yeah.
Where we are using a hierarchy to present the food again and again, sort of a slow desensitization method with a strong reinforcer to move us forward. So maybe
through all the senses too.
Exactly.
Like, the first is just looking at
look
the
at
food.
it. Is it on the plate, and are we okay with it being there, right?
Yeah.
That's step one. And if you really think about the things that you find most disgusting, which I think is really important for anyone doing feeding, we really have to consider, what would I do if they presented me with the most disgusting thing I can think of? And is it realistic for me to expect someone else to respond differently if they do truly feel disgusted by something, by a color, a smell?
Oh, yeah.
So certainly when our children struggle with sensory input to begin with, it doesn't surprise me that there are things that would be icky.
Yeah.
Yeah.
Well, I told you about my big problem, how I drove my parents
Oh, yeah.
crazy when I was little.
She was a very strong-willed child.
It was like, if the food touches, I won't eat any of it.
Yeah.
I can't touch. We can't mix textures.
Yeah.
Yeah.
Yeah. You can't leave the table until you eat that carrot.
Yeah.
And then at midnight, okay, go to bed.
Yeah, go to bed. That was liver. It's like, you're going to sit here until you eat this liver. I was like, yeah, I'll just sit here.
Mm.
My dad. It's time to get up and go to bed. I did not eat that liver.
Yes.
Yeah. And kids will do that. They will, if you give contingencies and you create power struggles,
You're going to get one.
yeah, you're going to get one. And you might lose.
Yeah.
Because kids will do things like planned ignoring. Planned ignoring can go off the rails. Because if a little child picks up an object and puts it to their eye, and they're like, it's like, you can't ignore that.
Yeah.
And the child will know. So be
Yeah.
careful of the contingencies you set. That's
For
so-
sure.
But back to food expansion.
Yes,
So PRT, we look
PRT.
at it, we touch it, we smell it, and very slowly.
Very slowly.
Yeah.
And the idea is that eventually you'll be able to take a bite and eat it without showing a sign of displeasure. So that is a sign that, hey, we are no longer very sensitive or very grossed out by this food, and we can move it into their regular diet. But it does move very slowly.
Yeah.
A similar method of a sequential presentation is done in speech and OT, but that is done typically without a reinforcer. So similar idea.
And that's called SOS, right?
Yes, that's right.
Yeah. Very similar.
Very similar.
But I think the PRT methodology is slower and more
It's slower.
systematic.
And it has that component of reinforcement,
Yes.
which leads me to another approach, which is our PREMAC principle.
Oh, yeah. Eat what's on your plate and then you get dessert.
Yes.
Right?
Yeah. That's the idea.
Yeah. Or take a bite of chicken, then you can have your chips.
Yes.
Yeah.
Exactly.
And parents use that all the time.
All the time.
And like, you need to take 5 more bites. Yeah.
Yeah. So also fairly similar. It just doesn't have that structured approach of, well, today we're just going to smell, or we're going to look, or we're going to touch. It's eat it and then you get this other thing that you like.
Yeah.
Yeah.
Absolutely.
And then mixing
Simultaneously pairing, right?
Yes. So we take something that we know we like and a very small amount of something new, and we pair them together and then slowly expand on the size of the new item blended within this experience to pair something new with something that we already like.
Yeah.
Yeah.
Like quesadillas, right? So
Yeah.
if we want our child to eat broccoli, we start slowly putting broccoli in the quesadilla. We slowly start putting onions in the quesadilla.
Yeah. Little by little. And that also works with some families. Now, none of these approaches, I think, are right for everyone.
Yeah.
And
And they take time.
they take time.
And don't push.
exactly.
If you push too hard, you get a power struggle.
Yeah.
Yeah.
So another program that I really like, which is done preclinically, developed by Yev Averka up in Washington. Shout out to Yev, BCBA. She works on meaningful meal times.
Yay.
So it's essentially looking at not only consumption of foods, which a lot of us are focused on, but also what is the experience at the table? Are we connecting with one another? And sometimes just modeling of eating foods and just saying, oh, I like that is enough. If you can reduce the pressure on the child, and it will also reduce the pressure on the parent. And then over time, eating is less of an aversive experience for everyone.